My name is Dimitri Daskalakis. I'm the Deputy Commissioner for Disease Control for the New York City Department of Health. Public Health Solutions has been working with Department of Health through all evolutions of this epidemic. In the early 90s, HIV was a certain death sentence. I often say that it feels like we had a generation that was deleted. Now we're working in a universe where we have a chronic disease. And so realizing that we are not about disease anymore and about health allows us to do really innovative programming to create not just a theory of how to end the epidemic, but a blueprint. We have a plan, we're sticking to it, and this is where our relationship with PHS is so important. Public Health Solutions, it does a very important thing. It helps us get our resources to the place that they need to go so folks in the community can actually do the work.
It's a pill you take every day to help prevent HIV.
Without that sort of foot in the field, you're never going to do well with HIV. The effect of undetectable being untransmittable, people being supported to maintain viral suppression, has resulted in the single largest decline of HIV diagnoses in 1 year. I like to think of New York City as a shining beacon for the rest of the United States. We are aggressively going to end the epidemic of HIV by 2020.
I'm Ayo Ali, and I work at Public Health Solutions. Tobacco use is an epidemic. The #1 cause of preventable death in the United States is smoking. 4,000 Manhattan high school students smoke. Tobacco companies spend $9 billion a year on advertising. And now with hookah and e-cigarettes, the only way to combat that is to empower youth. You have more places that sell tobacco and smoking products than playgrounds, libraries, or even schools. These products are normalized, they're everywhere.
If there's any way that I can tell people they're targeting us in these types of ways and we need to look out, I'm really for the movement.
Okay.
Students walk away armed with all this knowledge, and so they want to do something about it.
1, 2, 3. 3 signs on this storefront. There are actually no signs say that these products are harmful.
Hi, my name is Kyla.
Kyla, she has this sort of a shyness and uncertainty.
A year ago, I would have never taken on a leadership role.
So we actually took a trip to Albany, and she met with elected officials, and they see that their work actually matters. We're not in every school in New York City yet, and we need to be. The places we are currently in, when our students find out this information, the first question they ask me is, why didn't we know about this? I believe that this is a generation that can end smoking.
My name is Kiara. I am 24 years old and I have a almost 2-year-old daughter. I was born in Ecuador, but I came when I was about 5 years old. My mom started working at a factory. She wanted to give us a better future, a better education. I was diagnosed with epilepsy, and my mom had to stop working. And I had to stop going to school because I had to support my mom and support this apartment. I was upset because what I always wanted was build a career and education for myself. When I was 2 months pregnant, I felt like I needed something that would help guide me.
The first time I met Kiara, she was very quiet, she was very withdrawn, sort of ashamed, I would say.
My nurse, she was very sweet, very comforting, very easy to talk to.
How do you feel?
I'm very scared.
It was a little challenging. She was depressed, she was anxious.
She would set goals for me, like it would be long-term goals and short-term goals, like what do you really want to do for yourself?
We worked towards her heart's desire.
3 years ago, I would have never imagined that I'll be in this position. I never thought that I would have this in me. My goal was always to finish school. She made sure that my goal was still there, that my baby wasn't stopping that.
Today she is beaming with joy, this bright, confident young woman.
Miss Scarlett, my daughter, she's a very smart girl.
We do a lot of assessments. Miss Scarlett is doing wonderful. She is not even 2 and she knows her ABCs.
She's like at the mark where she's supposed to be.
And when I see her bonding with Miss Scarlett, it's just amazing. So I just couldn't believe it was the same Kiara.
It was the best thing in the world. The moment I stepped out from this door, I can't wait to come back and just see her. She's my happiness. I do this every day with a positive attitude. I feel like I always have someone there for me, giving me that motivation not to give up, to love myself. I feel empowered and I feel very happy. My nurse made a big difference in my life, and I'm going to miss her a lot.
When everything is going well, people try to dismantle public health, and the next thing that happens is it doesn't go so well anymore. Because that sort of piece, public health is sort of the glue that brings together a lot of different services. Or maybe even better, the concrete that brings together the mosaic that is really a healthy city.